Removing the sleek plastic casing of a modern MRI scanner reveals a dense, multi-vector electromagnetic environment. Inside this bore, operators subject human tissue to extreme physical forces. To acquire a diagnostic image, these electromagnetic fields must be generated and managed with mathematical precision. This management is governed by international standards. The MHRA regulates exposure for patients and staff, the IEC sets manufacturing standards for the hardware, and the ICNIRP dictates occupational and public safety thresholds. Regulators classify scanner operation into 3 modes. Normal mode handles routine studies, controlled mode allows for specific monitored scans, and research mode, which exceeds these levels, requires explicit approval from an ethics committee. Ensuring patient safety requires analyzing the machine's output as 3 distinct physical interactions, rather than a single hazard. These vectors are the static magnetic field, the radio frequency field, and the time-varying gradient fields. Comprehensive safety requires the simultaneous management of these 3 environments, as each interacts differently with human physiology and implanted materials. The foundation of the system is the static magnetic field. Powered by superconducting coils, this field is always active and generates immense kinetic force. This architectural layout marks the 5 Gauss line, the spatial boundary where the magnetic pole becomes strong enough to interfere with electronic devices. Anyone with a contraindicating implant, like an incompatible pacemaker, is strictly excluded from crossing this threshold. Ferrous objects that cross this line undergo the ferromagnetic missile effect. As the distance to the bore decreases, acceleration increases. At the center of a 1.5 Tesla magnet, a loose object can reach speeds exceeding 80 kilometers per hour. Inside the patient, this same force causes internal migration. Ferromagnetic fragments will rotate to align with the magnetic field lines like a compass needle. This rotational force makes ocular shrapnel or non-compatible aneurysm clips absolute contraindications for the MR environment. To limit these kinetic stresses, the MHRA caps whole-body exposure for patients at 4.0 Tesla in normal mode and 8.0 Tesla in controlled mode. Pregnant patients are limited to under 2.5 Tesla, and clinical guidelines avoid scanning during the first trimester. Staff safety is also regulated. Whole-body exposure must remain below 2.0 Tesla, and the 24-hour average exposure cannot exceed 0.2 Tesla. Static field hazards are mechanical. They create risk by turning external metal into projectiles or internal fragments into moving blades. The second safety vector is thermal, originating from the oscillating radio frequency coils. RF pulses induce electrical currents within patient tissues. These currents generate friction at the molecular level, which is then released as heat. This energy deposition is measured by the specific absorption ratio, or SAR, in watts per kilogram. A SAR of 1 watt per kilogram results in a whole body temperature rise of 0.5 degrees Celsius. The risk of overheating increases in patients with impaired thermoregulation, such as those with heart failure, fever, or those taking vasodilators and diuretics. Tissue conductivity also dictates how much heat is absorbed. Highly conductive fluids like blood and CSF absorb energy more readily than low-conductivity bone marrow. RF fields interact with metallic implants through the resonant antenna effect.
Oscillating pulses establish a standing voltage wave along a conductive wire, like a pacemaker lead. This energy concentrates at the tip, causing rapid heating and potential burns to surrounding tissue. Unlike the static field, RF hazards are thermal. They convert biological fluids and artificial leads into internal heating elements. Operators must actively manage SAR by adjusting the parameters of the pulse sequence to keep energy deposition within safe limits. This comparison shows the energy requirements of different sequences. A spin echo sequence uses large 180-degree pulses that result in high energy deposition, whereas a gradient echo sequence uses smaller pulses with a lower net thermal load. Field strength also scales the risk. Moving from a 1.5 to a 3 Tesla scanner results in a 4-fold increase in the specific absorption ratio. To reduce SAR, operators can increase the repetition time, spacing out RF pulses to allow the body to dissipate heat. Alternatively, they can reduce the flip angle to 90 degrees or less, decreasing the energy payload of each pulse. Strategies include reducing the acquired slices, lowering the room temperature, and wearing light clothing. Every scan requires a trade-off, balancing the need for diagnostic image resolution against the patient's biological thermal limits. The final vector involves the time-varying gradient fields used for spatial encoding. Rapidly switching magnetic fields induce eddy currents in conductive biological tissues. As seen here, these induced voltages can override natural nerve signals, leading to peripheral nerve stimulation and involuntary muscle contractions. If these induced currents reach extreme levels, they carry the theoretical risk of causing ventricular fibrillation. Above 3 Tesla, these gradients can cause vertigo, metallic tastes, or flashes of light on the retina by stimulating sensory nerves. The mechanical forces generated by these fast-switching fields also create significant acoustic noise. Scanners are capped at 140 decibels, and hearing protection is mandatory at 90 decibels to prevent permanent auditory damage. Gradient fields interact with the electrical nature of the nervous system, requiring strict adherence to ICNIRP thresholds to prevent sensory and physical disruption. During a medical emergency, the physics of the MR environment override standard resuscitation protocols. If a patient suffers cardiac arrest, they must be moved to an MR-compatible trolley and taken outside the 5 Gauss line before treatment can begin. Ferromagnetic crash carts, oxygen cylinders, and defibrillators cannot be brought near the magnet, as the static field will pull them toward the bore. Fire protocols require the use of non-ferrous carbon dioxide extinguishers, which must be kept at a distance of at least 1 meter from the bore. If someone is pinned by a metal object, or if a fire cannot be contained, the operator triggers a quench, the rapid decommissioning of the magnet. A quench boils off more than 1,000 liters of liquid helium, instantly stopping superconductivity and eliminating the static magnetic field. The expanding gas vents outside. If a leak occurs, it displaces room oxygen, creating an immediate asphyxiation risk requiring full evacuation. MR safety requires the simultaneous regulation of static pull, thermal energy, and electrical induction. Maintaining these 3 physical forces within biological thresholds is what allows for diagnostic imaging without injury.